Good morning, my name is Kavita. I am 35 years old. I was suffering from acute back pain since April 2022. I was into heavy gymming for some time, but later I discovered that this back pain was not because of weightlifting and heavy exercising. It was something else. I consulted a doctor in Gurgaon, an ortho, who conducted an MRI, and I was diagnosed with a disc herniation. This back pain was making my life almost immobile. This back pain was also going into my right leg. I was not able to sit and do my daily activities like a normal human does. But from April till December, this pain was getting worse. I was not getting any relief in spite of getting steroids. I also took a steroid injection, but that did not even aid me. This pain in the month of December, this pain got as acute that I started getting limp in my right leg. I was almost kind of paralyzed, so to say. I consulted a physiotherapist and he referred me to Dr. Rajan at Artemis. He's the head neuro here. With his comfort and the kind of confidence he gave to me, he suggested me for a lumbar spinal surgery.
Kavita is a young 35 years old working woman who was referred to us for her back pain and leg pain of 7 months duration. She had shown to many other hospitals and doctors where she was recommended that she will need to undergo surgery for the relief of her back and leg pain, but the surgery will be open surgery. Now, being on the overweight side, her weight was about 120 kgs when we first saw her. She was worried that an open surgery will require a very major long incision. It will result in a lot of pain, blood loss, muscle tear, as well as wound healing issues. So when we told her that at Artemis Hospital now we have technology where we can do these procedures by just keyhole surgery, so she was convinced, and once we did the surgery, we were able to make her walk the very next day. Her pre-op pains completely disappeared in a couple of days, and I'm glad now that it's been 3 months, she's doing very well.
It was done through a keyhole laser surgery. The surgery went well. In spite of the kind of weight that I had at the time of surgery, I was not very confident with the outcome that I would have. I had a lot of inhibitions about the general anesthesia. But Dr. Rajan gave me utmost confidence, and he ensured that I will not have any consequences during the surgical procedure and also after that. Thankful to Dr. Rajan that I was able to get back on my feet immediately after the surgery. It went on for some time, and the next day the physiotherapist came and they put me back on both my legs, which I was not able to do before the surgery. I was not able to sit for long, I was not able to stand for long before the surgery, but the immediate next day I was able to do everything that I could, like a normal healthy person could do.
So thanks to the modern technology, we are now able to perform surgeries even in patients who are upwards of 130 kgs through just a keyhole procedure, because it involves insertion of tubes wherein the diameter required on top for the incision and the surgical area is almost same. So the incision is same whether the patient is thin or heavy. These patients who are unable to get treatment because the doctors tend to recommend either open surgery or they tend to recommend that they should lose weight before surgery, now no longer need to wait for either a weight loss or for open surgery. Because of the keyhole procedures, we are able to get them up and about the very next day.
Bond he has with all his patients, and specifically with me, I would not say that I've got it from anybody else. When do you actually see a doctor calling a patient and to ask the patient's well-being? I remember the day of my discharge, I had just reached home, and I got a call from Dr. Rajan asking about my well-being and if I reached home safely, if I have any pains. That usually doesn't happen. That's usually done by Dr. Team, but he takes care of his patients very well, and I would suggest anybody who's suffering from this pain to not let one's life get hampered. Please do consider getting the surgery. If you need to get this done, please do consult Dr. Rajan for this.